People are buying painkillers now more than ever before. That's according to a new study by the Drug Enforcement Administration.
And the increase in pain medication sales has experts pretty worried. CBS 19's Courtney Friedman joins us now. And Courtney, what does this spike in sales really mean?
Well, guys, the increase has coincided with a wave of overdose deaths, pharmacy robberies, and other problems. According to the Drug Enforcement Administration, in 2010, doctors prescribed enough painkillers to give 45 milligram Percocets and 24 5 milligram Vicodins to every person in the United States. Painkillers may be prescribed to you by your doctor, but experts say they can be just as addictive and deadly as many illegal drugs. Tylerite Sharon Brown knows that firsthand.
I've had several friends who have become addicted to them, so it happens very fast.
The Centers for Disease Control and Prevention say tens of thousands of people overdose each year in the U.S., and the numbers are growing. Dr. Luis Haro oversees the emergency departments in Trinity Mother Frances Health System. He sees dozens of people each day affected by prescription drugs, mainly painkillers.
15% of the patients will develop an addiction to it, dependence to it, within 2 weeks of being on them.
The new DEA study shows those addictions are driving the spike in painkiller sales. Users are even going to what's called doctor shopping to keep the prescriptions coming. If one doctor won't prescribe what they want, they'll go to someone who will.
People have pain, they get on the medications, they get a little bit better, they start abusing it, subsequently they need more, and if they don't have it, they have worse pain than they had before.
Experts say the increase in sales is partly due to the aging population with pain issues and a greater willingness by doctors to treat pain.
It's amazing. You get a whole thing of hydrocodone and you only need maybe some Tylenol.
So how do you stop the problem from getting worse?
And I think it's probably an awareness issue. I don't think that people probably even think about it. They just haven't thought about it as a problem.
With overdoses and addictions at an all-time high, experts say it's not just a problem, but an epidemic. Experts also say the sales are increasing in many areas of the country where there are few places to treat people who get hooked. And as you can imagine, Justin, that just adds to their worry.
So what do doctors give as other options to deal with the pain?
Well, Dr. Haro tells me that prescription meds aren't always the answer. Physical therapy, some types of injections, and procedures from pain specialists provide other ways to relieve pain and help avoid addiction. Back to you.
Okay, Courtney, thank you. The study also shows painkiller sales are rising the most in these parts of the country, Appalachia, and also the Midwest.